entire organizing team for having me. It's a pleasure coming back home to IIT Kanpur, and I also want to reminisce my process of being hired here at IIT Kanpur in 2004, and I was one of the initial people who was in the domain of bioengineering but working on nanotechnology. And those days, Professor Sharma was already working in the domain of nanotechnology, but the center was not yet there at that time. And so in that context, he and I were having a conversation, and he had some very interesting things to share with me. And one of them was that, you don't have to buy a house in India if you're an academician, because you can continue to work till 70, and then you can go and rent, and how long are you going to live anyways? 75, 80, and then you're going to die. So, 10 saal ke liye kyun itna pareshan hona hai? That was his advice that he gave me. But anyway, jokes aside, I'll get started on a more serious topic. I can see some people who are interested in this topic. So the health crisis in India is what I thought I should share with you. I'll talk about some statistics and some crises, and then I'll talk about the opportunities that are there. First, I'll start with the challenges. So, assuming this audience is not very familiar with types of diseases, the most simplest classification is non-communicable diseases and communicable diseases. This is common knowledge nowadays. And within non-communicable diseases, you generally have diseases which are chronic in nature, which last for a long time. And communicable diseases are ones that you get infected by and which you can potentially infect others through. So these are the two classifications. So I have acronymized them for the sake of convenience as NCD and CD. So I'll go by that acronym. I want to only talk about these four in non-communicable diseases: diabetes, cancer, obesity, and mental health disorders. I'll start with some simple statistics. This is about diabetes. So first, global and Indian. I'm giving you two test statistics. Globally, there are 589 million adults that are living with diabetes. This is a 2022 data from WHO, the World Health Organization. And this map that I'm showing here below, the world map, this is from Lancet in 2024. And you can see that the circle where India is the largest circle, as a consequence of which India is now referred to as the diabetic capital of the world due to the highest numbers. And all of us here are more than the age of 40, 50 years of age, and you know that this used to not be the case. And we've had a significant change in our lifestyles that has led to this kind of a undesirable statistics. Cancer. Globally, 19.9 million new cancer cases were diagnosed, and close to 1.4 million new cases in India, of which 0.9% are dying. More than 50% of the diagnosed cancer cases in India finally die. We have around 35% survival rate only in a certain set of cancers. And you can see here these pie charts. So, breast is not only high in terms of incidence, but it's also high in terms of mortality. These are all WHO statistics. Lung used to be pretty high, but lung has gone down now. Breast is up. Lip and oral, primarily because of this gurkha chewing in India. And again, another women cancer, cervix-uterine. So if you combine breast, cervix-uterine, you see that the percentage of cancer patients in the women population is pretty large. Obesity, just in case you are thinking that it's a more Western world problem, it's not. It's an Indian problem. 2. Globally, by 2030, 50% of adult men and women will be living with high BMI. BMI as defined by the Western population, 25 to 29. 17% of men and 22% of women will be living with obesity, which is BMI greater than 30 and above. In India, as of 2021, 24% of Indian women and 23% of Indian men are overweight or obese. And this, in my opinion, is not a reflectance of affluence anymore. We are not, by any standard, considered as an affluent society, but our lifestyle has become not so good. And what high BMI does is it makes you prone to all these four circles which are drawn around BMI: diabetes, cancer, stroke, ischemia. So you get more and more prone towards that. And look at our population. 1/4 of the men, 1/4 of the women almost are all suffering from high BMI. Mental disorders. Again, there is a sort of a concept or misconception in the Indian population that, India doesn't have too much of a mental health issue. But again, sadly mistaken. Globally, 970 staggering numbers, 970 million suffer from mental disorders. 82% are low and middle income countries. See, this is a very important observation that 82% of the 970 million population in the world, majority of them, 82% are from low and middle income countries. In India, we have around 197, which is a little more, closer to 1/4 of the total population, world population, suffering from some form of mental disorders, and that translates to around 14.3% of our total population, which is really, I would say, depressing. And this I'm just showing you to show that there are different types of mental disorders. The first left-hand side map is idiopathic developmental intellectual disability, which is where causes are not attributable to one certain specific factor. And you can see that idiopathic developmental intellectual disability is more prominent in North India, the red states, whereas depressive disorders are more prominent in South India. And we have multiple such disorders, and there's a variability in how it is distributed in India. So this is as far as few examples of non-communicable diseases go. I'll talk quickly about 2-3 communicable diseases. This is probably known to many because these are well publicized in literature. Tuberculosis, malaria, and dengue. Tuberculosis, again, 10.8 million people are sick from TB, of which 27% of that whole global mass or sick TB population is in India. And as you can see here, we are also the largest, unfortunately, in terms of TB affected patients. Malaria, fortunately, is coming slightly under control now. And of the 263 million, only 2 million are in India. You can see here, South America and Africa, they take a large burden of malaria. And this is dengue. Dengue or dengue, as you want to call it, 100 to 400 million infections globally, and 63,000 of them in India. Numbers may be low, but when dengue comes in, it quickly infects. Large numbers of people get affected, so that you almost get an epidemic sort of thing. So these were a few communicable diseases. Now I will come to some of the opportunities. Although the statistics are not very encouraging, but we do have some interesting opportunities. Let me start with first point of care diagnostics. So this is what Professor Dr. Bashakir was talking about in the morning, one of those examples that he gave on Shwasa, something like that. So point of care diagnostics could be affordable detection kits, and affordability is a factor that matters in India. In fact, matters in the entire world, but more so in Africa and Southeast Asia. Wearable biosensors, precise and early detection kits, and early detection is becoming increasingly important so that we can save patients with life-threatening diseases, and rapid detection kits. Just one example I want to give. This year, a paper was published in Science Translational Medicine. This is on a rapid tuberculosis diagnosis from respiratory or blood samples by a low-cost portable lab and tube assay. This is from University of Tulane, this group. And I wanted to just take a look at all the things that come about from this kit. precise and rechargeable, battery powered, result in 1 hour, and cost is 236 rupees. So this is something, that, so there's also a misconception in academia that if you do things that cut costs or bring costs down, that cannot get published in the type of journals like Science and Nature. In case there is that misconception, I want to correct that misconception. In digital health, there are apps, there is AI-driven diagnostics, there is health education platforms. This is one example in-house, IIT Kanpur example. This is an unguided computerized cognitive behavior therapy intervention. So this is a sort of a software or a game that patients have to play. It's called treadmill, and those who completed at least half of the module, not even the full module of treadmill, showed a significant reduction in depression-related and anxiety-related symptoms by just playing the game. So this is a software-based intervention for mental disorders. It's my colleague Nitin Gupta, who's also an IIT Kanpur alumnus, has developed this. It's gone into clinical trials and it's being done in the United States. Opportunities on lab on chip, high throughput drug screening. In the interest of time, I'll just quickly show you the example. This is one that has been commercialized. This is a tumor on a chip, which can be used for drug screening, disease modeling, can also be used for diagnostics, and can be used for multi-data analysis. 3 companies in the world have commercialized it, 2 in Europe and 1 in the United States. And this is something that technologically, a lot of researchers are also working on in India. And then in non-communicable diseases, nanoparticle-based drug delivery systems, there is cancer, osteoarthritis, and eye-related diseases. And I thought I'll present this example. So I was talking about diabetes, and we are the diabetic capital of the world. The one thing India has done well about diabetes is diabetes management. There are, of course, we have a large number of people who are diabetic, but everybody lives long enough, at least 20-30 years with diabetes, and they manage their diabetes. But what that leads to is secondary complications of diabetes. You live more than 10 years with diabetes and you start developing secondary complications such as neuropathy, nephropathy, or in this case, what I'm showing, diabetic retinopathy, which affects the eye. So in diabetes, if you have retinopathy, then there's extra growth of blood vessels, and it sort of gives you black spots in your vision and eventually leads to blindness. If you want to inject any molecule in the eye, then everything is invasive. So you can't do repeated injections. And since a diabetic patient is like a chronic diabetic patient, so therefore he has to get repeated injections. So you can't do an injection. So you need something that is not going invasively. This is our work, which was published in Nanoscale, which is a non-invasive eye drop which contains nanoparticles. And you put these eye drops into the eye, and they cross the barriers of the eye, go back to the posterior eye in the retina, and they disallow blood vessel growth. These yellow arrows that you're seeing there, or yellow dots, on the extreme right bottom, you can see that the number of yellow dots has decreased, which means the new blood vessels that are forming, those have gone down significantly. So these were a few examples. Now I'm going to talk about actionable points. These were all technology-based science interventions or science and engineering interventions. So let me talk about scope in research. So these are actionable points, just a few actionable points. So research, I think this audience, I don't have to tell much, but these are a few points. The only thing that I feel that this part of the talk distinguishes is in this type of research you need engineers, you need scientists, and you need clinicians. So this kind of work actually demands, because all validation is done on patients, so you need to have clinicians as well. Again, that point on startup, while we always hear a fantastic startup culture is happening in India, I can tell you this much, the extent of startup in the biomed sector is far lower compared to the amount of startups in all other sectors. And that's because of the fact that there is a regulation for every product that eventually ends up inside the human body. And that regulatory process is a long process, it's a long drawn process. There are clinical trials, phase 1, phase 2, phase 3, and they can take as long as from few years, 5 years to 15 years. So therefore, there are these challenges that are there, but then I would say we need to pay attention as people who are sitting on committees and people who are part of regulatory bodies. I would urge you to consider this. Then this is an important point I feel for everybody in this audience, that room, anywhere in India. We as individuals need to be very careful about our health. Goes without saying, everybody is conscious. But you don't know that there are multiple silent killers that are already there. So, sugar and sweetened beverages, if you ask me, you should not even bother about getting close to it. Second, government of India has already put whatever they could. But if you ask me, we should not have allowed the likes of Domino's and Burger King to even enter our country. We just, we have to take responsibility for our actions. Urban planning is one thing that can be done. We can do things such that we encourage people to walk more. Stringent nutritional labelings so that people are more conscious, and workplace wellness. Before closing, this is the last one. Protection on the second last one. Sorry, protection on environment and public health. The first one, sanitation and hygiene. I don't have to say much. Right up to the Prime Minister's office, everybody is worried about it. So that's being taken care of to quite some extent. But still, we have a long way to go. Air pollution reduction and air control, vector control, and then wastewater management are factors which are important for environment and public health. And lastly, the pandemic, of course, gave us a fantastic experience. But vaccination programs in India, we still have scope for betterment. For example, we don't have a very strong infrastructure for cold chain, which most vaccines need. We need to work more now on mRNA vaccines. We have begun the process, but we need to do far more. There has to be a public-private partnership, especially in this space. Of course, Serum Institute of India did demonstrate a good public-private partnership, but still we have scope to do a lot more. And finally, giving tax incentives for vaccine manufacturers. That's the summary, which is self-explanatory. So basically, my point is that as a country, we are not necessarily heading in the right direction as far as health parameters are concerned. Our population has to be sensitized far more. We have to become more conscious. We have to take responsibility for our own health and our next generation's health. And we can do as much as we can as learners and individuals. Thank you very much for your attention.